So I'm Jayne Miggin. I'm the Inclusion Health Nurse Specialist, one of two, in the Mater Hospital in Dublin. So I'm the chair of the Inclusion Health Section, which represents nurses and midwives who work with people in inclusion health populations. So inclusion health really is a relatively new take on medicine and nursing, and really what it does is it looks at individuals who are socially excluded for various reasons. So it's not limited to particular groups, but it's people may be socially excluded because they may be homeless, they may be seeking international protection, they may be in addiction, they may be from LGBT minority groups. So these groups by definition find healthcare difficult to access because our health services were not set up for these groups. The healthcare system was really set up, and this isn't exclusive to Ireland, this is across all Western countries. The healthcare system was set up really for the housed, the literate, that can read and write, that can see, that can hear. Stigma stops them seeking help because many of them have had negative experiences with healthcare. If you think of yourself, how many times have you gone to maybe a restaurant or a hotel and you've had one negative experience, you're like, I'm never going back there again. It's the exact same with this population. They've come to the Mater and they've had a negative experience, they won't come back again. Sometimes in the busyness and the chaos of our roles, we just need to sometimes take a step back, think, okay, what baggage has she brought with her before? What had she to do to come here today? And what I learned from a colleague in my previous role is she used to say to the patients, thanks so much for coming in outpatients. And I was like, brilliant. And you'd see them light up. Something like that, because for them it's such a big deal for them to come in for an appointment. So it's really take an approach, and it's to really have an open mind to see the view from that person. So I've learned a lot from the populations I have worked with, the view that they see that I never saw growing up or in nursing. So I always say to younger nurses and students, I wish I knew then even a fraction of what I know now back then when I was younger, when I was a student, because I would probably have changed my practice and my attitudes, being quite honest, a bit differently. Members of the section are nurses and midwives who either work with inclusion health populations or maybe work in the academic side with inclusion health populations. So we have academics who teach on subjects in relation to inclusion health, social exclusion. In terms of the undergraduate programme embedded, that it's not just sporadic. So at the moment there is a lot of work done with the universities we're aligned to, and I know the same is done other colleagues, let's say, they're academic institutions, but it needs to be embedded in the curriculum. Well, I suppose if I use homeless populations in particular, the research is lacking because it needs more time, it needs more investment, and it needs people who will go out to those communities, out to those groups. You can't expect them to come into the hospital to be part of your research study. It doesn't work like that. So the research is lacking, and hence when you're developing services, and you need data and research to develop healthcare services, but if you don't have the data on your homeless population, for example, how can you have an equitable service? So it's really important we do research on these populations as well. Housing. I cannot reinforce. As I've said, the numbers since I'm in this job in 5.5 years, which is a short time in the grand scheme, in a lifetime, the numbers of people who are homeless has doubled. Almost 5,000 of them are children. The paediatric colleagues would say because of, and this is why I couldn't work in peds, they're meeting mums with new babies in hotels and they can't wean them onto solids because they don't have a kitchen. So that basic need, that's not healthcare, that's housing. If I was the Minister for Finance, I'd be putting the money into the children. Full stop. That's the priority. Health, housing, education, additional needs, additional support, everything. Yeah, it's cross-departmental. You're investing. It's like putting the foundations in your home. You're investing in that foundation, because unfortunately, I'm not writing adults off, but by the time you meet me, the levels of ill health you've suffered, the level of trauma you have suffered, the level of stigma you've suffered, there's a lot to be worked on. I want my role to become non-existent. I want to be made out of a job, because you shouldn't need people like me, really, in theory. That really inclusion health is everybody's business. Inclusion starts with us.